morning, everyone. I'm Lise Leveille. I'm a pediatric orthopedic surgeon in Vancouver, Canada. I'm a former Stanford gymnast and a proud Canadian Olympian. It's a pleasure to be back at Stanford and an honor to moderate this session on preventing ACL injuries, a new technology for a persistent challenge. I feel the weight of this persistent challenge on a daily basis in my clinical practice. A common clinical scenario that I see is the 14-year-old female soccer player presenting with a twisting knee injury. The story is familiar: an awkward landing, a swollen knee, stiffness that lingers, and then slow resolution of symptoms. More often than not, this patient will have a complete tear of their ACL and will require surgical reconstruction to stabilize their knee and allow them to return to their sport. We know this is a common and growing problem amongst adolescent female athletes. And frequently, this diagnosis is initially missed in these adolescent patients. Their initial acute symptoms resolve, and they go on to return to their sport and suffer recurrent episodes of instability, which results in more significant and severe intra-articular pathology in the form of meniscal tears and articular cartilage damage. And unfortunately, delayed presentation and surgical management is disproportionately more common in our most vulnerable youth, those coming from lower socioeconomic households. And this is a pervasive issue that transcends borders and healthcare systems. Even though our patient was fortunate to have presented early, she still requires surgery, and it will be over a year before she returns to competitive play. For adolescent female athletes, this is a life-altering event. It disrupts their closest social connections, strips away their athlete identity, and introduces significant mental health challenges. Many experience symptoms of depression, anxiety, and even PTSD. And in addition to this initial emotional toll, there's long-term consequences for joint health. Clinically, we're working hard to try to innovate and improve the way we stabilize these ACL deficient knees, but it's not enough. Too many athletes struggle to return to their pre-injury level of play, and when they do, they're at high risk of re-injury, like we heard earlier today, and then also like what happened for this patient here, both of their injured limb and their contralateral limb. An ACL tear often marks a turning point in their athletic journey and their future joint health. That's why today's session is so important. We're going to hear from three outstanding speakers and researchers whose work has the potential to fundamentally reshape how we understand, prevent, and manage ACL injuries. Together, these talks will illuminate new pathways for improving outcomes in young athletes and offer a future where an ACL injury is not a defining moment, but a preventable one.